Hi, my name is Leja Kidwell, and today I'm going to be talking to you about abnormal psychology, more specifically anxiety, depression, bipolar, and eating disorders. Now, abnormal psychology, what is it? Why do we care about this? Well, abnormal psychology is the study of unusual behaviors, thoughts, and emotions that can be assigned for a disorder. So, what makes this so abnormal is, well, think about a box and think about our norms and think about our norms as a society and as a culture. And all of these norms for us are inside of this box. Now, anything outside of it, any different types of activities or thoughts or behaviors that occur outside of this box, we deem as abnormal. Now, what makes this a disorder is when it becomes to cause harm to oneself and as well as others. Now, anxiety disorders, what is this? So, an anxiety disorder is the feeling of nervousness, of overthinking, um, basically just being in your own head about something. So, some symptoms with this is restlessness, so sorry, is feeling jumpy or feeling tense, not being able to sleep, letting your brain go 1,000 miles per hour. It's a feeling of just anticipating for the worst or thinking about the worst of things. So there are many different types of anxiety disorders, but because you guys are in high school, I want to talk about the three more important ones that I think go hand in hand with high school and growing up and getting to that college stage. So first, I want to talk to you about agoraphobia. Now, agoraphobia is it's a disorder where one is uncomfortable or afraid to be in a public setting or in a public situation. So this person feels more comfortable and more safe when they are at home or when they're in a more secluded area. That makes sense. Now, generalized is pretty much when you're just worried or you're fearsome about different types of things in life. So generalized is more of a, like in the name, general approach to anxiety. That makes sense. So social anxiety is when you're more in a social environment. So I know in high school, being at parties, presentations, making new friends, that type of anxiety is more social. There's different causes and treatments for this. So, biological causes is just like it sounds biological, where it is more based on your genes and genetics, and where it can be from, you know, an auntie or your mom or dad or, somewhere along like a family line. Psychological and environmental factors, like I mentioned previously about being in high school, it can be about those surroundings. Maybe it's due to like pressure or just trying to be in those social norms. There's different ways to manage anxiety. For me, when I manage my anxiety, I try to breathe in, I try to live in the moment. But when all fails, when you can't do this, that's when you try to get more treatment. And with that treatment, you get offered medication, therapy, and more so self-help. Now, depressive disorders. Now, a depressive disorder is when you're feeling down, when you're in a slump, when you have low mood, not as much function as used to. This can also affect your appetite, your your sleeping, and this brings me to major depressive disorders versus persistent depressive disorders. Now, with depressive disorders, it sounds just how it is. It's major. It has more of an effect on your mood and your everyday activities. So with major depressive disorder, um, it's more so like you wanting to kill yourself. You're in your head too much, and it's beginning to affect you and others. Whereas persistent depressive disorder is not as I want to say not as big and not as just not as big. So with persistent, it occurs more often and uh it's just more tedious. Bipolar disorders. Now, with bipolar disorders, I like to think of the weather when I hear bipolar. It's hot and then it's cold. You know, it's these two moods or three or four. It's just a lot of moods happening at different times, sometimes throughout the same day, sometimes it's not. So there's key features, there's mania, hypomania, and depression. So mania and hypomania kind of go hand in hand. It's more on the happier side. So um with this, they're more joyful, they're doing things that's outside of their norm, like they're more cheery, they're more talkative, they may place a lot of bets, you know, they're more cheery and chippy. Whereas depression is basically how it sounds, where they're in their slump, they're low, they don't want to be bothered, um, and they kind of just want to stay to themselves. Now there's bipolar 1, there's bipolar 2, and there's, say with me, cyclothymic disorder. Um, Now with bipolar 2, I want to just skip into this because it's more major and it's more so with the mania, hypomania, and depression, as well as with the cyclothymic disorder. It's not as much as the hypomania and depression. So it's not as, I don't want to say not as important, but it's not as like it's not as strong, if that makes sense. So causes and treatments for this, there can be a bunch of different causes for this. So there can be genetic, it can be neurochemical, and it can just be things that happen that in your life. So I know I had a friend that both of her parents died and she was in this major depression for over 2 years. And this has to do with the life stressors. So there's different things in your life that can happen that can cause you to be depressed. And the treatment for this is basically like any other disorder. There's antidepressants that you can take, which is medication, mood stabilizers, and then you can also do therapy. Now, eating disorders. There's a common misconception that an eating disorder just has to do with wanting to eat a lot or not wanting to eat at all. Now, there's different emotions and different types of behaviors that can occur when you're in this eating disorder. Some common features with this eating disorder can be your preoccupation with food, with your body weight, and with your shape. There's a bunch of different eating disorders, but the three that I want to focus on is anorexia, bulimia, and binge eating. Now, with anorexia, it's people have a misconception that people with anorexia just want to be skinny. They just want to stay slim. Um, but with this, they also tend to eat less and because they want to fit, because they don't see themselves as skinny. Now with bulimia, this person eats a lot at once and then they try to get rid of it in a way like and vomiting, and throwing up and taking laxatives, exercising. And then lastly, there's binge eating, where a person is eating a lot and sometimes they don't even know it. Causes and treatments, like I said earlier, there's sociocultural pressures, there's psychological factors, and there's also genetics. And same thing with this is that there's different counseling, therapy, and medical intervention. Now, lastly, I just want to say that it is important to remember that um, early diagnosis is very, very important to help you get a hold on these disorders quickly. And also, I want to encourage everybody to reduce the stigma that any of these disorders make someone less human or like as if that they don't matter or that they're just a creep or a freak show. And this is not the case. Some of these disorders you can't control And I think it's very important that we all remember that our mental health does matter. So thank you for watching this. Hope you guys have a blessed day. Thank you.